Good evening, everyone. Thank you for joining us for Optimal Nutrition for Fertility and Pregnancy. My name is Donna, and I'm with GENESIS Fertility. With us today is Dr. 𝗖𝗹𝗹 from Simplicity Health Associates. Dr. 𝗖𝗹𝗹 is a naturopathic doctor in New York City with expertise in women's health. I'm going to ask everyone to please hold their questions until the end of the presentation. And without further delay, I'm going to turn over the controls to Dr. 𝗖𝗹𝗹.
Thank you so much, Donna, for having me back on. Hi, everyone. My name is Dr. 𝗖𝗹𝗹. I'm a naturopathic doctor, and I'm here to talk all about nutrition and how it pertains to fertility and pregnancy. So, because naturopathic medicine is not always that well known, I always like to start all my presentations just talking a little bit about what naturopathic medicine is. So basically, naturopathic medicine is a patient-specific system of medicine which utilizes natural therapies to stimulate the body's own healing potential. And one of the ways I love describing naturopathic medicine is by our 6 guiding principles listed there. And I always like to pick a few that really pertain to what I'm talking about. So in any presentation, I'm acting not just as a doctor, but also as teacher. I really also feel when it comes to nutrition, it's very much aligned with prevention and preventative medicine as being the best medicine, and also working with the whole person and really treating the whole person. So why is nutrition so important for fertility? Well, actually, looking at nutrition and fertility is nothing really new. Many traditional societies actually put women on special diets that were trying to get pregnant. The ancient Greeks, for example, recommended cutting out alcohol to women preparing to become pregnant. And then the ancient Romans had a little bit of a different approach, recommending the eye of a hyena, dill, and licorice. Well, if we're thinking about modern day, some of the biggest factors that are affecting fertility when it comes to nutrition, one is the overconsumption of trans fats, refined carbohydrates, and animal proteins, as they can have a big negative impact on ovulation. And I'll talk a little bit more about that in the presentation. Also, that key vitamins and minerals are essential for both men and women when it comes to healthy reproduction. And then lastly, and this is something that I'm going to be talking a lot about today, is that unfortunately, being both overweight or obese negatively impacts fertility, not just in women, but also men. So let's first start off with talking more about how overweight and obesity affects fertility. So unfortunately, obesity actually often is one of the primary causes of infertility. In fact, we see about 6% of infertile women that is actually their primary cause of infertility, or one of the primary causes. And one of the reasons is that with obesity, you're seeing higher conception times. So an increase in conception, meaning the amount of time it takes to conceive. Also an increased rate of miscarriages. And that also, what's interesting, that with each increasing amount of BMI, which is body mass index, we actually are seeing a decrease in conception about 5%. So some of the reasons for this is that when with obesity or being overweight, we're seeing a dysregulation in a couple different hormones. One is leptin. And so we release leptin from our fat cells, and this signals to the hypothalamus in our brain that we shouldn't be hungry. Now, one of the issues around the more fat cells you have, this can have an impact on leptin. And basically, this increase in leptin is actually going to affect how our ovarian cells actually produce eggs. And then another hormone, adiponectin, also produced in fat cells, and basically it's there to break down fatty acids and energy. Well, with lower levels of this hormone, we're seeing an increase in insulin, and the more insulin that's circulating, you're also going to have a decrease in sex hormone binding globulin, which basically has an impact on how much of our testosterone is going to be converted over to estrogen. And we need healthy levels of estrogen to support ovulation and pregnancy. Obesity also affects men as well when it comes to fertility, with men having BMIs over 25. So that's the classification for being overweight, obesity per se, showing poor sperm motility and lower sperm counts, as well as increased abnormalities in sperm. And another big part of this is with increased body mass, you're also, just by very nature, you're going to have higher scrotal temperature. So basically more body mass covering the testicles, increasing the temperature, and that's going to have a big impact on sperm. And then the last part is how I was saying before, with women with increased body mass, increased fat cells, women tend to have higher testosterone levels. Well, opposite in men. So with men, the more fat cells that they have, we're actually seeing a decrease in testosterone levels, and optimal testosterone levels is very important for men when it comes to fertility. And they also will end up having elevated estrogen, and basically as men increase fat cells, their aromatase enzyme gets increased, its activity increases, and it's that enzyme that is responsible for changing testosterone over to estrogen. And so these men are going to have a higher estrogen to testosterone ratio than normal weight men. Now, obesity and being overweight doesn't just affect trying to get pregnant, quote unquote, naturally or natural conception, but actually does have an impact on fertility treatments. So superovulation, IUI, we're seeing that in women who have BMIs over 28, there are lower pregnancy rates. Also, obese women tend to have lower estradiol levels, so they actually will end up requiring higher dosages and higher duration of gonadotropin injections. Obese women tend to also have lower conception rates. And then we've been talking a lot about using BMI, but actually waist to hip ratio is actually a better predictor than BMI. So that's basically how your waist measures to your hips. So in women, the hips should be greater than the waist. And with each increased unit, we're seeing a 30% decline in conception. And also being overweight and obesity definitely also impacts IVF, in vitro fertilization. Obese women have lower rates of pregnancy. And again, we're also seeing, similar to the IUI, an increased need for medications to stimulate ovulation. There's also an increased risk of cycle cancellation due to poor follicular development. The other issue around IVF and obese women is egg retrieval. So there's fewer eggs retrieved. And a big part of this is the difficulty of actually retrieving the eggs from the ovaries because of being actually higher up in the abdominal cavity. We're also seeing that of the eggs retrieved, there's a higher percentage of more immature eggs, which have less success when it comes to producing embryos. And then there's also an increased risk of premature or preterm births in obese and overweight women who undergo IVF. So what about donor eggs? So like the standard, the best possible donor eggs. Even with donor eggs, we're seeing reductions in live births in women with BMIs over 35. Well, the good news is that weight loss actually does help. So basically, when infertility is due to weight, spontaneous conception will occur in about 70% of women if this is the true root cause when weight is normalized. And even as little as 5 to 10% reduction in body weight has been shown to dramatically improve chances of pregnancy. So though, yes, weight loss really can help with fertility, there definitely is some challenges when it comes to weight loss. First being that rapid weight loss, specifically weight loss due to very low caloric intake and high exercise, does affect egg quality and fertilization rates. And so when we're thinking of rapid weight loss, what we're really talking about is about 8.8% reduction in weight in a 6-week time. So definitely rapid weight loss is not what we're looking for, because it also, in addition, affects fertility treatments as well. The other issue around weight loss is maintenance. So maintenance is also, or weight loss maintenance is also really important even during pregnancy. Obviously, during pregnancy, we gain weight, but gaining too much weight can be problematic. And maintaining weight specifically to prevent cardiovascular and diabetic issues during pregnancy. And regardless of losing weight for pregnancy or losing weight for other reasons, only about 15% of dieters in general are able to maintain long-term weight loss. So with that challenge, one diet that I personally use in my practice, because I really feel it works, is the Mediterranean diet. It's definitely a diet approach that works regardless of when I'm working with couples that have weight challenges. It is definitely my favorite approach, and it's also been the most researched. So when it comes to the Mediterranean diet and weight loss, it really seems to be much better than other forms of weight loss strategies. First of all, that following a Mediterranean diet has been shown to lead to moderate weight loss and loss of abdominal fat. And one of the biggest benefits I find with the Mediterranean diet is maintenance. So with patients maintaining weight loss of 9 to 22 pounds, even after a year. And it has actually been shown to be more effective than low-fat diets and comparable to a low-carb diet. But different from the low-carb diet, the Mediterranean diet has been shown to be superior when it comes to long-term weight loss. And so some of the reasons why it works for weight loss, one, it's definitely in comparison, specifically if we're thinking about a paleo diet or a keto diet, it is much more flexible and a lot easier to follow. It also, because of the encouragement of high quality fats and proteins and fiber rich vegetables and whole grains, it is much more satiating, and followers tend to feel more full. They don't feel that same level of deprivation, and just the encouragement of a wide variety of foods also helps with feeling satisfied. And so the Mediterranean diet, when it comes to fertility, I know we've been talking a lot about the importance of maintaining a healthy weight when it comes to fertility. It does not just help with weight loss, but there's other reasons why the Mediterranean diet can be very effective for fertility. First, studies have shown that women that women following a Mediterranean diet in comparison with those that weren't, we're seeing a 44% less difficulty conceiving naturally. And it doesn't just affect women who are trying to conceive naturally, but also following a Mediterranean diet can improve the outcomes of fertility assistance. So in the case of IVF, we're seeing a 66% better chance of conceiving with each cycle when women were eating more vegetables, fruits, whole grains, legumes, fish, and olive oil. And some of the reasons why the Mediterranean diet can be very effective is that it's very rich in folate. And if you've been working with a fertility specialist or know anything, you probably already know the importance of folate. Also, it has very rich in vitamin B6. So women who've been following this type of diet tend to have higher levels of folate and B6 in their red blood cells and their follicular fluid. Also, the Mediterranean diet is very beneficial when it comes to blood sugar stabilization and cholesterol levels. So that's also very, very important for fertility and pregnancy. And again, really helping with the maintenance of a healthy weight. So here's some of the breakdown of some I guess levels to try to hit if you're following a Mediterranean diet. So definitely fish. Now, one fish is very important as it's rich in omega-3s, but it is also at the same time, you need to be careful with which fish that you're choosing because mercury and other toxins can definitely be found in the cord blood. So it is really important to make sure that you're having a very clean fish. One of my favorite guides for finding out which fish to eat, which is safe and which is not, is put out every year by the Monterey Bay Aquarium, and it's their safe seafood guide, and it's free and you can download it. It's really fantastic. Omega-3 rich eggs. So these are eggs where the chickens were fed typically flaxseed meal, but it has a higher DHA content, and DHA is very important for the formation of babies' brains. Also, eggs are very rich in choline, so I usually will encourage my patients to have 1 or 2 per day. I know often like cholesterol is always a big fear, but for the most part, most studies have shown that egg consumption is not always leads to high cholesterol. And in fact, actually having some cholesterol is really important for the formation of hormones. And then less important is definitely poultry and red meat. Though if you are going to have red meat, I definitely encourage you to have grass-fed meat, basically because it has a higher omega-3 versus more inflammatory omega-6 content. So more fish and eggs, less poultry and red meat, and then vegetarian proteins. So making sure to have some vegetarian proteins like beans and lentils a few times a week. Vegetables. So vegetables are really, really, really important. I encourage my patients to get about 4 to 6 servings a day. So that's anywhere. So that ends up to be about like 2 to 3 cups per day cooked, and really encouraging those dark leafy greens. So making sure that at least 2 of your servings are coming from dark leafy greens. So a couple things, definitely as we age, because of stress, this has an effect on egg quality, and all the oxidative stress is affecting egg quality and decreasing ovarian reserves. And one of the ways to counteract all this oxidative stress is adding rich antioxidants. And where do we get most of our antioxidants? But from fresh vegetables. So vitamin C, vitamin E, and selenium, these are all really, really important for egg health. And the last thing I always probably get is, does organic matter? Yes and no. So the Environmental Working Group always publish out. They have what they call the Clean 15 and the Dirty Dozen. So vegetables and fruits listed on the Clean 15 don't necessarily have to be organic, but those listed on the Dirty Dozen should be listed as organic. And the list changes every year, so it's always good to go on their website to get the most accurate information. But the unfortunate reality is that pesticides, which are found on certain non-organic fruits and vegetables, can be both problematic for fertility, but also for child development. Grains and starchy vegetables, I usually encourage my patients to have about 4 to 6 servings per day. If you are someone who is gluten intolerant and gluten sensitive, definitely want to make sure that they are gluten-free. And this is also a really good source of fiber. Healthy fats, so having a rich diet in specifically olive oil and flaxseed oil, hemp seed oil, and then nuts and seeds. And this kind of goes back to earlier thinking about antioxidants, and one of the important antioxidants often found in these foods is vitamin E, so having a diet rich in vitamin E. Fruits and fruits, so having fruits, and again, following guidelines around the Clean 15 and the Dirty Dozen. And fruits are a great source of antioxidants. I really like dark berries, and dark berries are really rich in resveratrol, which you might have heard, which is found in wine, but it's a very strong antioxidant. So like blueberries and dark grapes and cherries, all really, really excellent. Full fat dairy. So this slide might be news to you, but interestingly enough, that women who consume 2 to 3 servings of low fat or no fat dairy products actually have a greater risk of ovulatory infertility, whereas women who regularly consume full fat dairy actually have the opposite effect. Now, I wouldn't necessarily say that everyone needs to have dairy. If you are lactose intolerant or you know that you can't handle dairy, this is not necessarily the time to have it. But if you tolerate dairy and you want to have dairy, definitely full fat is where it is at. And the reason is androgens, which are our male hormones, things like testosterone and DHEA, are water-soluble hormones. So when you take out the fat, all you're left with is your water-soluble hormones. So because milk in general is full of hormones, even if you are buying organic, because again, the cow dairy, the goat dairy, that milk was meant to grow a baby calf, or a baby goat. And so it's rich with hormones. So if you're getting the non-fat, low fat, you're getting a lot more of those androgen male hormones. And then also you are going to increase insulin, and insulin in general tends to be more, or is more androgenic, versus our female hormone, estrogen, is actually a fat-soluble hormone. So it's actually found more in the fatty part of the milk. So if you are going to have dairy, definitely have full fat dairy. So the Mediterranean diet for dad, somewhat similar, some things a little bit different. So here we see some recommendations around protein. In general, with men, I recommend less eggs than I do their female counterpart. I also encourage actually more vegetarian proteins. It's been shown to be more beneficial. Similar servings for vegetables, grains, and of course, again, depending on activity levels and dietary requirements for the man, still fruits and fats and nuts and seeds. And I don't necessarily always recommend dairy for men. Now, you might have heard about the keto diet and that can also help with fertility. Now, I wouldn't get so excited. Well, first, there's a lot of misinformation on what the keto diet is. So a lot of people think that the ketogenic diet is just a low carb diet. Well, that's not really the full story. Really, the ketogenic diet is a high fat diet. So not all low carb diets are ketogenic, though the ketogenic diet is inherently low in carbs. It's really much more of a high fat diet. And where the buzz came about when it comes to fertility in the keto diet was really just one study that looked at 11 obese women with PCOS. And it was shown that after 24 weeks, that 5 of these women did have reduction in weight, reduction in testosterone, more favorable luteinizing hormone to follicle stimulating hormone ratio, lower fasting insulin. And then at the end of the study, 2 women did become pregnant. Now, why I am very cautious with this is one, it is only one study. Do we know would normal weight women benefit from the keto diet? I'm not sure. Why I would be concerned about the keto diet in general is that because you have such a low vegetable and fruit intake, I would assume that the vitamin content is quite low. And I wouldn't necessarily advise this for all women, and this could be something to potentially consider. But again, because the research is so limited, I don't necessarily recommend that in my practice. So here's some other dietary considerations. So the first is, what is the worst food for moms? Well, surprisingly, the worst food for moms is actually breakfast cereals, and not just any breakfast cereal, but cold breakfast cereal. And many women that do have these cold breakfast cereals, it's I guess like the worst of two worlds, because often there's using skim milk or low-fat milk, or even using some of these like non-dairy substitute milks that also are always very, very favorable. And the reason cold breakfast cereals is the glycemic index. And these foods tend to be very high in glycemic index. There's probably some cold cereals on the market that are higher in fiber and protein and don't have that same effect. But most cold cereals in general are very high in the glycemic index, and high glycemic index foods like candies and cookies and crackers and chips all increase the risk of ovulatory infertility. Also, sodas are also very much on that list. And one of the big things with high glycemic foods, so these are foods that really spike your blood sugar, you're going to have a rapid increase in insulin. And when you have a rapid increase in insulin, you're going to see a decrease in sex hormone binding globulin. And basically, so typically, if you have nice levels of sex hormone binding globulin, it's going to bind to testosterone, which is a good thing because you want your testosterone to turn into estrogen, versus when you have not a lot of sex hormone binding globulin, you're going to have more free testosterone, and that's going to cause a lot of issues. And it's something I definitely see related to PCOS and polycystic ovarian syndrome. So definitely, it's probably, if you're trying to get pregnant and you have been eating cold breakfast cereals, it might be a good time to change your morning routine. And so what are some of the worst foods for dad? Well, a lot of snack foods, and it's for a couple reasons. So one of the big things is that most processed snacks, and this includes even kind of like ones that you might think are a little bit healthier, things like graham crackers and pretzels, most of these contain cottonseed. And cottonseed actually naturally has a component called 𝗖𝗹𝗹. Interesting, 𝗖𝗹𝗹 actually inhibits sperm function and at one time was actually being investigated for male contraception. So if your partner, your husband, your boyfriend are really into processed snacks, you might want to read the ingredients and see if it contains cottonseed oil. Though again, none of these foods really have any nutritional benefit, but definitely don't want to have him eat that if it has cottonseed. The other issues also with snacks like these, too much saturated and hydrogenated fats all have an effect on sperm fluidity, basically because it affects the cellular membranes of sperm, which is going to affect motility. So on the other side of that, so saturated and hydrogenated fats are not beneficial when it comes to fertility, but on the other side, increasing polyunsaturated fats from fish and olives actually improves sperm formation activity and sexual function. So maybe swapping out a lot of these these foods for almonds and olives, maybe even making or fish. So definitely swapping out these snacks. They're not really serving anything when it comes to fertility. Okay, so some other things to be aware of. So caffeine. So caffeine does have an impact in fertility, but the big part is being careful or monitoring how much you actually are having. So definitely caffeine at high levels, so we're talking about 300 and 500 milligrams, can definitely impact fertility. And if you're smoking, this is going to make that even worse. So I wouldn't necessarily say that you need to completely eliminate coffee or tea, but if you're having more than 2.5 cups a day, it might be a good idea to decrease and work on perhaps even having just 1 cup or doing a half calf. Alcohol. So alcohol really is not going to be that beneficial for both men and women because it is, just by its very nature, is toxic to ovaries and testes, and it has a big impact on hormones. So it does affect both estrogen and testosterone, which is going to affect the menstrual cycles. And we're seeing in studies decreased chances in conception based on alcohol consumption. Again, this is something where you might not necessarily have to completely eliminate alcohol, but you might want to really make sure that you're not having too much. So in my practice, my general guideline actually for most of my patients, because I work a lot with hormonal issues and acne, is typically no more than 3 drinks per week. And never more than 1 per event. And that's actually very much in line with the American Heart Association's guidelines when it comes to alcohol consumption. So that was my presentation. I'm happy to answer any questions. I also have a little fertility meal plan and recipe guide if you'd like, and you can email me that, and I'm happy to share that with you.